Closed donning is recommended best practice to prevent contamination. Hands remain inside the sleeves and should not touch the cuffs while donning is assisted by another scrubbed team member. The gloved scrub nurse grasps the glove firmly and steps away from the sterile field. Holding at waist level, the glove is stretched open with thumbs extended beneath the glove cuff with the palm of the glove facing the team member. With the cuff covering their hand, the team member then inserts their hand into the glove as the scrub nurse pulls the glove upwards so that the cuff of the glove fully covers the cuff of the gown. The other hand will be repeated in the same manner as the first. With one hand already gloved, the team member can assist by pulling open the cuff while donning their ungloved hand. The assisted process is then repeated for the outer gloves. After double gloving, the team member adjusts their gloves as needed and inspects for integrity. The scrub nurse can assist the team member with the final gowning process.